Got it. Got it. You can even feel the muscles are tighter here. So I'm going to rub out the deltoid a little bit. Little doggy massage. I found some trigger points. Let's try one more time. Bring that arm all the way up. Beautiful. So we have Kara here today, and Kara has a dog named Coby. Tell us the breed, the age, and the health condition.
Cool. He's, I think, a pit bull Staffordshire Terrier, and then he's almost 9. He'll be 9 at Christmas. He was diagnosed with cancer in November, and it's been downhill and then uphill, and yeah.
And what have you noticed about symptoms or his health overall?
Well, in November, he was like sneezing blood everywhere and hemorrhaging. He had lost a bunch of weight and he was having trouble breathing. And then in about February or March, he just started getting better. I had tried like changing diets and stuff, but it didn't really work. And they were just like, keep him happy. And I did the CBD, and that's the only thing that changed. And he's just been on the uphill since then.
That's awesome.
Yeah.
And tell me about the arthritis. Where do you notice that the most? In the rear end?
So it doesn't come out very often. It's when he kind of like pushes himself really, like he runs very fast and gets very excited. It's really just like, I can see it when he's like not that comfortable. Oh, there you go. Good boy.
So if a dog or a human comes to me with cancer, I don't treat cancer, so that's not my goal. A lot of times not a lot, but over the years, people will call up the front desk of my office and go, does Dr. Doug treat cancer? The answer is no, I don't treat cancer. But people with cancer, people with diabetes, people with any type of ailment in their body would benefit from a chiropractic adjustment because it de-stresses the nervous system, it relaxes the body, it helps the body perform at its highest level of health possible. It's one of the great self-cares that you could give to your body. And same with the dog. So this dog does have a little arthritis. He's 9 years old, and when you're working with a compromised immune system with cancer, it never hurts to get your nervous system de-stressed through chiropractic adjustment. So one of the things I'm feeling right now is the space between the atlas and the angle of the mandible, which is the jawbone. And the space feels pretty good, but let me just see as I turn the head if it stays even. And I'm looking for how that joint closes down on rotation. Now I'm going to check the head down and check it back up. So coming up, it's really easy. And going down, it's resistant. So I'm going to adjust, the first thing I'm going to adjust is an anterior atlas. And one more. You're not going to hear a pop like on humans. Got it. Now let's recheck that. Sit again. So now let's check. Down and up. Good. Now I'm going to just rub the muscles of the neck. One of the other things that dogs like sometimes is just this little forward pressure on the face. There you go. And I'm checking now the cervical, C2, C3, C4, C5. Checking each little section here. There's a little bit here at C5. Got it. Checking thoracics. Coming down the back. Motion, palpation on every joint coming down. So dogs have 7 cervicals, 13 thoracic bones, and 7 lumbars. Humans have 7 lumbars and 12 thoracics. So they have 2 more lumbars than us and 1 more thoracics. but we have the same amount of cervicals. Now I'm all the way down at the sacrum, and I'm feeling a little tightness here. Actually, that's at L7, so that's the 7th lumbar. Now, I might have you, Kara, hold his head for this one. So I'm going to adjust his lowest lumbar just before it meets the sacrum. And I'm going to pick up his hind leg a little bit. Got it. Good. Now let's bring the leg back now. A little resistance there. See? So the left leg comes up, but he doesn't jerk it away. But the right leg pulls it away a little bit. So I'm going to check the height. I'm going to adjust an AI ilium on the right. So this sometimes makes them yelp a little bit. But the last 2 times I did it, they didn't. So one more. Nope, no change. He didn't yelp. So let's check. Come back around this way. I'm going to check the range of motion. Okay, one more. Good. Check the knee. Good. Checking each little toe, ankle, the knee, the hip, the tail, this knee. That feels good. Let's bring this leg up like this. So we're going to bring the leg all the way forward. And then we're going to check shoulder. That's good. Checking each little limb. This one's a little tight. That shoulder's out a little bit. So we're going to bring the shoulder up. Got to first figure it out, but I think he has, the humerus is a little anterior. Okay, let's try it now. Bring that, there you go. There you go. So that upper arm bone was out. Got it. Got it. You can even feel the muscles are tighter here. So I'm going to rub out the deltoid a little bit. Little doggy massage. I found some trigger points. Let's try one more time. Bring that arm all the way up. Beautiful. Yeah, so this left shoulder was out a little bit.
Yeah, I've always noticed that arm is a bit tighter than the
Yeah,
other one.
it's tighter.
Like he'll do paw on one leg, but not the other, ever.
Yeah. Good. Mobilizing it. Stretching. Gonna come around, stay where you are, and I'll just come to you. Okay, and one more. Got it. Now we try it. Bring that. Okay. I think that is it. Let me just check the tail. Got it. All right, we're all done.
Cool. Look at that, Cobb.
Was that his first chiropractic adjustment?
Totally. Yeah.
All right, let's see him get down and see if he shakes. Okay, can I take him off his leash?
Yeah, totally. He's very.
So when they shake after an adjustment, it means they kind of integrated it all. So let's see what happens. Well, he saw his food right away. Note to self: don't have food when you're looking for the shake. Let's walk away. Let's let him know. There it is. So we want to see that shake. There you go. There you go.